Ever you wonder about prominent ear treatment? Let's break it down. Place the patient in the supine position on the operating table. Use the chlorhexidine to brush the hair away from the ear. Use the swabs to clean the ear and face. Drape the patients. And use the ruler to measure the distance from the mastoid to the outer edge of the helical rim at the upper, mid, and lower point of the ear. Fold the ear back and identify the position of the anti-helical fold. Use the marker pen to draw a line on the back of the ear in line with the anti-helical fold. Insert the tip of the needle in the subcutaneous tissue beneath the skin marking. Inject the local anesthetic and advance the needle towards the top of the marking, injecting simultaneously. Use the scalpel to make an incision along the pre-marked line. Use the electrocautery forceps to cauterize any bleeding points. Use the swab to dry the area. Use the scissors to blunt dissect the skin from the cartilage on the lateral side. Use the scissors to blunt dissect the skin from the cartilage on the medial side. Ask your assistant to insert the skin hooks into the lateral edge of the incision and hold the skin up. Use the forceps to lift the skin and the electrocautery forceps to cauterize any bleeding points. Continue cauterizing any bleeding points until the cartilage is exposed and can be visualized. Perform the first bite of a single interrupted stitch at the lower part of the incision through the cartilage. Check the front of the ear to make sure the stitch hasn't gone through the skin. Perform the second bite of a single interrupted stitch at the lower part of the incision through the cartilage. Do a single throw to test the position of the stitch and the effect on the ear prominence. After testing the individual stitch, untie it and apply the clip. Perform this process to insert 4 more stitches extending from the lower part of the incision, proceeding superiorly. In short, you carefully test the effect of each individual stitch on the ear prominence. Once you have completed the 5th stitch and are happy with the effect of each on the ear prominence, remove the clips from all stitches and tie down each stitch. Perform the first simple interrupted suture at the lower part of the incision. Continue closure of the skin with additional interrupted sutures, working from the lower part of the incision superiorly. Use the ruler to measure the distance from the mastoid to the outer edge of the helical rim at the upper, mid, and lower point of the ear.